one of the challenges we are facing in our work office, the highest paid employees have the opportunity to work from home. So doctors, for example, are able to do telemedicine. However, our lowest paid employees, medical assistants, for example, have to be in the clinic. This has created a have and have nots in the office and hard to manage teams that have to work together. What suggestions do you have?
Christy, and thank you for sharing that, Mike. It's not a direct answer to your question, but it's also an observation to this. When we went and moved to the work from home, many organizations just assumed that their employees could pick up and start working without realizing many of them didn't have internet at home because they have it on their phone and they work in an office with an internet. And so the expansion of our minds of not assuming, removing some of the biases that we have of expectations of how other people live, we have to be aware that, again, as you mentioned, our service industry is not able to really pick up and do work from home. They are out serving, they're seeing clients, they have to do face-to-face. Restaurant industries, they can't work from home. So what is it? I don't know what the answer is, but we have to do something different because everything is not going to move to a remote environment. But we also have to look at equity in pay because that is what's important as well for those that are doing the service work.
Yeah, Mike and I interviewed a number of people for our second report around blended workforces. And one of the interesting things, and I think you might find this as a parallel, Mike, is in healthcare. A lot of the leadership had the opportunity to work from home, yet it was demotivating if the frontline workers did not see their leaders. So while it was possible, the decision in many organizations has been, if you are a director and you can do your work from home, you will go into the hospitals, you will be going into the clinics, people need to see your face, and also providing an opportunity for people to be able to be recognized, maybe not just by compensation, but um, recognition was really important. We see you here, we know the sacrifice you're making. And it's actually, I think, a little bit of a challenge now because I think earlier in the year, especially for people who are on the front lines in healthcare, there was a lot of celebration and there's a feeling that perhaps that's dying down a bit. But, you know, just the recognition of, we appreciate you being here, thank you. And thinking through, is there a possibility of some of the work that can be done at home? So is there a way of flexing it all? And if so, is that something that you desire? Because some want it, some would rather not do anything in their homes. And I think that that's been part of the challenge for many people too. Just, I don't have a choice and I really don't want people seeing into my personal space. I don't feel like I can cut it off. And that makes it really hard.